23-year-old. What can I do about bags under my eyes? I'm a 23-year-old female. I have bags under my eyes, and I was wondering what my options were to get rid of them. When I smile, you can see I have extra skin under my eyes, and the skin is wrinkled. Attached is a picture. I look very tired when I smile, and my eyes appear small. Please let me know what my options are. Thank you.
Thank you for your question. As someone who's 23 and concerned that your skin is loose, particularly when you smile, this is certainly a common concern and question that a lot of people have. And with the photos you submitted, the things that I can make a diagnostic call on are a few things. One is, of course, that your skin is very light. And when people who have very light skin, very often the skin under their eyes is almost transparent. And because it's transparent like that, you can see the red quality of the muscle and the blood vessels under the eyes. And when you have very light skin and you have thin skin, when you smile, the wrinkles are more obvious. Well, the things that you are experiencing are basically genetic. Now, the things that we can control, of course, are environmental. So, if someone has light skin, in my practice, I always advise them protect, 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 using sunblock, moisturizers, do everything you can to reduce the external aspects of your environment that can accelerate your age-related or aging changes. We sometimes refer to like sun exposure as photoaging. The other thing that we also remind people is avoid toxins such as smoking. So I tell people, the eyelid skin is the thinnest skin in the body, and to avoid smoking. Now let's assume you're not a sun worshiper and you're not a smoker, and you're doing all the right things to protect your skin. You've got a moisturizer with sunblock. There is a subtle hint in your photo of a little bit of puffiness. And in our practice, when someone has a very slight amount of puffiness, we tend to avoid doing a surgery as the first procedure and give them the option to see if they like a temporizing procedure, something that helps soften the appearance of that little bit of puffiness. And in our practice, we'll use a filler, and that filler is placed in the tear trough area, as well as the eyelid to cheek area. It's done very conservatively and done in a way to minimize the chance of lumpiness. So and the material that we typically use is something in the hyaluronic acid family, and routinely we'll use a filler like Restylane. So considering a filler like Restylane to help with the eyelid to cheek area to add a little bit of volume and soften the transition is one option. The other thing that we do for a lot of our patients who have very thin skin, we want to build up that collagen. So we'll do something called, do a procedure called platelet-rich plasma, where we draw your own blood and we actually concentrate the part of the blood that has the active healing properties, such as when you get a cut, and the cut, it heals with cells called platelets. So in other fields of medicine, this particular technique has been used to help with wound healing, and athletes are getting it injected into joints. And we use it under the skin. And we found that we've been able to help a lot of our patients with this injection treatment. Often we need to do more than one over the course of several months, but people really appreciate the improvement in skin quality, and very often, and actually very recently, a lot of our staff members in our practice have been availing themselves to the same injections. So clearly we've been getting a lot of good feedback about it, and our staff members have been getting the injections themselves. So I'd say conservative options first, and however, if you notice that the puffiness under your eyes is more constant and very prominent, then you may want to consider a surgical procedure. But I'm not going to discuss that given the photos don't seem to have that much puffiness in them, and it seems to be more about, for you, skin quality and volume and texture. So again, to summarize, a filler for the tear trough area, the eyelid cheek junction, as well as platelet-rich plasma to help the skin quality improve. I hope that was helpful, and thank you for your question.